Hi, I'm Dr. Charles Denham. I'm chairman of TMIT Global and a co-founder of the MedTech Bystander Rescue Care Program. This is an executive summary of our progress to date and our plan going forward.
Now, as our country is recovering from the COVID crisis and deaths are topping 600,000, we have three opportunities to keep saving lives. Immediately during local outbreaks, along the full reopening bridge, and once we all get to the new normal. We've come a long way, but we have a long way to go. First off, we have to thank our now more than 100 subject matter experts and community leaders on our rapid response team, and the world-class experts who contributed to our 2 Discovery Channel films and leadership training programs whose messages had great impact. We also have to thank the world-class medical centers and organizations who participated in our multi-institutional study of more than 1,000 family responses addressing readiness, response, rescue, recovery, and resilience during the crisis. Finally, we're very thankful for the college students, alumni, and faculty of leading universities serving through our global student outreach program that is driving safety through networks of teens and young adults. Our Coronavirus Care Community of Practice is a rapid response initiative built on the existing platform of our MedTech Bystander Rescue Care Program we started in 2015 at major medical centers, schools, and in communities. MedTech fuses the best medical emergency practice with tactical action, which we developed as a rapid response system for active shooter and terrorism events at the world's largest medical center. We discovered that good Samaritan care can beat failure to rescue for the 8 most common emergencies. Bystanders can triple the survival rate in emergencies before EMS arrives by some very simple training. CPR and AED use for sudden cardiac arrest, the Heimlich maneuver for choking and the rescue of drowning victims, Narcan for opioid overdoses, use of EpiPens for life-threatening allergies, bleeding control during active shooter events, and prevention and care of infections, prevention of drive-over accidents, and prevention of bullying. Simple skills that can be learned in just a matter of a few hours. MedTech is the only program in the world that trains all of these Good Samaritan rescue skills at one time. It began saving lives in the first 7 weeks before our very first graduation of children. We now train anyone from 8 to 80, professionals and the public alike. When the coronavirus crisis hit, we were expanding to communities in 5 states. We convened our rapid response team when the coronavirus struck in Italy and then in New York early in 2020. We originally sought to meet a vital need, helping the essential critical infrastructure workers in 16 industry sectors designated by Homeland Security. Those who care for us, keep us safe, and keep the food, water, and power flowing to our homes. Those who have to go to work no matter what. They were the most vulnerable, and there were no safety training resources for them and their families. Our original belief was that family transmission chains were our Achilles heel. This is now supported by the evidence. However, our big surprise was that our program for essential worker families hit a nerve with the general public, who sought to be trained with them. This dramatically expanded our reach. So now for our progress. We established a national community of practice, launched a multi-institutional study with major medical centers totaling 1,000 family responses, hosted 32 live 90-minute broadcasts and converted them into on-demand recordings, produced 12 Survive and Thrive training programs, co-produced a National Campus Safety Summit with Campus Safety Magazine, published multiple consumer and medical articles, established student-led programs at major universities, provided free continuing medical education hours for healthcare professionals, produced short video summaries for mobile devices, developed rapid response programs to prevent spread during family holiday and student gatherings, produced a national vaccine hesitancy student outreach program with students, alumni, and faculty from leading universities, and initiated a smartphone applications development program. Our leaders made terrific contributions to the program while they've been on the front line caring for patients in the ICUs, like Dr. Greg Boats at MD Anderson. Emergency medicine leaders including Dr. Casey Clements at the Mayo Clinic, Dr. Toph Peabody at UCSF, and Dr. Chris Fox at UCI. Infection preventionists and nursing leaders like Heather Foster and Professor Mary Foley were educating families and nurses. Our law enforcement and first responder leaders include Chief Bill Adcox and Matt Horace, Chief Security Officers from MD Anderson and Mayo Clinic respectively, and Randall Steiner, the Director of Emergency Preparedness at the University of California at Irvine. This said, and although infection rates and deaths are dropping across the nation with a significant proportion of our population getting vaccinated, I wish we could say we're out of the woods. However, we're not. The bad news is a vaccine hesitancy and the relaxation of infection prevention safe practices, while mutated viral variants are now challenging our recovery. Those from the UK, now known as Alpha, the South African variant called Beta, the Brazilian variant called Gamma, and the variant that has swept India called Delta may be more transmissible, more lethal, and may be more likely to affect our young. At the peak and year end, we had more than 2 new infections every second and more than 2 preventable deaths every single minute in America. The growth was absolutely explosive, and the doubling time was measured in days. Thankfully, the vaccines have had enormous impact. However, we must be very careful during our recovery if we do not have full herd immunity and variants develop mutations, allowing them to escape vaccine-generated immunity. The worst-case projections are seriously concerning. Our seniors have historically been the most vulnerable to COVID. However, the majority of the elderly have already been vaccinated. Most people are very surprised to hear that there is a spring surge of hospitalizations in teenagers, with nearly 1/3 requiring intensive care and 5% having to be on ventilators. This is why we need a rapid response. Our rapid response team of college students, alumni, and faculty from leading universities and medical centers have developed the Take the Shot, Save a Life initiative to tackle vaccine hesitancy, targeting hundreds of high schools through an existing network of high school leaders. Our college student leaders and young adults will mentor the high school students to drive success through their families on the reopening bridge. And when we reach the new normal, they'll drive what we're calling good and safe Samaritan bystander rescue care in all communities. The reported drop in infections and deaths nationally is deceiving. This reflects the impact of the vaccines on seniors. However, people under 50 are the fastest growing group experiencing infections and death. But these are just numbers, and we've become numb to the numbers, but they don't explain the absolute cruelty of this disease. Most of us, especially doctors and scientists, deplore exaggeration for effect. However, the final moments of our loved ones will have them starving for air with strangers they can't see and never be able to say goodbye or get a chance for us to tell them we love them. As a retired cancer doctor, I face the death of my dear patients every single day. But this is totally different. Vaccines are starting to have real impact. However, it will be too late for many of our families, friends, roommates, and colleagues. So what have we learned for the next surge or pandemic? The good news, and even the great news, is that the very families that are our weakest link can become our greatest strength. Now that we know that family infection transmission chains are our Achilles heel, we can break them by direct actions at the source, at the family and roommate behavior level. This can turn the tide of the next surges in a matter of weeks. It can be done. We have 3 big opportunities: to save lives immediately and block the surges to come, to save lives as we cross the reopening bridge to the new normal, and then when we're at that new normal, to practice safe bystander rescue skills we know save lives before emergency services arrive. The original target of our MedTech program. The CDC, state, and county public health guidelines change almost on a daily basis with the science. That's why every family needs an evolving family safety plan to convert the science to safety. The CDC tells the public the what to do, which is terrific. We teach them the how, the actions they can take to turn the science into safety for their families and friends. Our Survive and Thrive series of courses have helped families come home safe, assess their threats and vulnerabilities to keep their kids safe, create family safety plans, know how to use family plan templates, know how to care for loved ones at home, Learn how to update the family plan along with the evolving science. Learn emergency rescue skills. Know what to do when loved ones are in the ICU. Understand vaccines and variants. Learn about COVID long hauler conditions. Identify the best practices on the road to victory. And learn what will be important to keep our families safe from emergencies at the new normal when we're through the crisis. We will continue to engage leading medical centers through their experts in a continuous improvement project to study worker-family vulnerabilities to drive our rapid cycle innovation team. And our student and alumni-led programs at major universities are providing real traction in super spreader groups. Now, after a year of work, we're publishing the results of our R&D from 1,000 family responses. We will continue with the study until the crisis is over. We will continue to apply our predictive analytics innovation development methods and care path mapping program to address the most important COVID family impact scenarios. This allows us to generate impact calculators that show us where to have the most impact by direct action. Since our series of Survive and Thrive guides hit a nerve with the general public, and our studies showed they wanted to be trained with essential worker families, we'll continuously update them and expand our reach across community sectors in 2021. All families need to keep up on the evolving science of the virus, the reasons for social distance, hand hygiene, the risk of high contact surfaces, the use of masks, avoiding crowded and indoor spaces, mixing household bubble groups, and testing for isolation and quarantine purposes. Most importantly, they need to know how to prepare to care for someone in their homes and when to seek emergency care. We provide the answers to the most critical questions as we cross that bridge, such as how to increase social activities safely. We will continue to use well-known motion picture fictional stories and real-life true stories of innovation, courage, commitment, and accomplishment to inspire families. As we move forward, we will leverage the power of data science, machine learning, and artificial intelligence to drive our digital outreach and social media impact. The care of our communities is absolutely critical. Thank you for all you're doing to protect those at risk and those who are most vulnerable. As we say to all of our MedTech bystander rescue care teams, we have to fight the good fight, finish the race, and keep the faith. Everyone is a patient, and everyone can be a caregiver.